Hello everyone, welcome back to our channel Radiatic. Now we discuss radiation units and measurement. Just think, same radiation but different units. What it mean? Like Roentgen, Gray, Sievert. Why so many units in a same radiations and what do they actually mean? Let's understand step by step. First see X-ray in air, the unit will be in Roentgen. If it is inside the body, the unit will be in Gray. If there is biological effect or risks, the unit will be in Sievert. Why? Same radiation, different meaning. Why so many units? Because radiation behaves different at each stage. Like how much radiation present in air tells by exposure. It does not tells what happened inside the body. That means exposure tells that how much ionization in air. Okay, the exposure is denoted by X. Its formula is dq by dm. Dq represents the charge and dm represents the mass. Okay, that means how much charge deposit in per unit mass, that is exposure. The SI unit of exposure is coulomb per kg. There is another unit of exposure that is called as Roentgens. It is the old unit of exposure. So that 1 Roentgen is equals to 2.58 into 10 power minus 4 coulomb per kg. Now we move what happened when the radiations deposited inside the body. This is absorbed dose. It tells how much energy is absorbed by the body. It's denoted by D or DAB. Its formula is D is equals to dE by dm. D, that means how much energy is deposited. Dm, that means per unit mass. That means energy deposited per unit mass of material is called as absorbed dose. Its SI unit is Gray or joule per kg. 1 Gray is equals to 1 joule per kg. Here is another unit of absorbed dose, that is the older unit of absorbed dose, that is rad. 1 Gray is equals to 100 rad. Now we understand exposure is in air, dose is in body. But is absorbed dose enough to understand the risks? No. Let's go further. Now we move toward equivalent dose. What it mean? See, all type of radiations also not having same behavior. Different type of radiations causes different damage. That means 1 Gray of X-ray is not equals to 1 Gray of alpha, because of all kind of radiations having different radiation weighting factors. So that the equivalent dose depends on the weighting factor of the radiations. So the equivalent dose is denoted by H. H is equals to D into WR. D is absorbed dose, WR is the radiation weighting factors. Like that, X-ray having the weighting factors 1, gamma ray having also weighting factor 1, electron having weighting factor 1, but the alpha having the weighting factor is different, that is 20. Neutron having also different, that is 5 to 20, depends upon the neutron energy. Its unit is Sievert. See, it is Doge, but its unit change. That is not Gray. That is in Sievert. Because of this is equivalent dose. It's consider the radiation weighting factor. But see, organ also matters. So move towards when organ matter. That is effective dose. It consider organ sensitivity. Okay, that means the overall risks. It depends on the tissue weighting factors. Each organ have different weighting factors, so that E is equals to sigma of, that means summation of WT into H. H is that equivalent dose and WT is represents the tissue weighting factors. Each tissues having different weighting factors, so that effective dose comes in a scene. Okay, so its unit is same as equivalent dose, that is Sievert. So now we are just near to the final. Okay, so now we see what is activity. It tells how many nuclear decay happen. So that activity is equals to decay rate. It represents by capital A. A is equals to dN by dt. It's also represent disintegration per second. Okay, so its SI unit is Becquerel. Here is another units of activity, that is Curie. This is the older unit of activity. So that 1 Curie is equals to 3.7 into 10 power 10 becquerels. It's where Curie is also a bigger units. So mostly we use Curie in radiation physics. Summary. Here is the summary of entire lectures, that is quantity, formula, units and meaning. Like exposure, its meaning is that ionization in air. Its formula is dq by dm, that means charge deposited in per unit mass. Its unit is coulomb per kg. Another quantity is absorbed dose. Its meaning the energy deposited per unit mass, that means d by dm. Its unit is gray. Here is another quantity, that is equivalent dose. It considers absorbed dose with radiation weighting factor. So its meaning is radiation effect. So that H is equals to D into WR. D that means absorbed dose, WR that means radiation weighting factor. Here we see the unit is changed. The unit is that Sievert. Okay. The next quantity is effective dose. Effective dose consider the whole body risks. That means is consider the absorbed dose and the tissue weighting factors and radiation weighting factors. Here, so that E is equals to summation of WT into H. H is that equivalent dose and WT is tissue weighting factors. So that its unit is same as a equivalent dose. Its unit is Sievert. Next quantity is activity. Activity that means decay rate or disintegration per second. So that A is equals to dN by dt. Its unit is Becquerel. So now we understand why same radiations having different units, because we are measuring same radiation but different things. Thank you so much to being with us. Now we see next lecture in next video.